Let me welcome you once again to this press conference. The number of cases in the community has continued to fall this week with a handful of cases every day. The situation at the migrant workers' dormitory has remained stable, although the number of new cases remain high, primarily because we continue to step up our screening of migrant workers in the dormitories systematically to prepare them to go back to work safely. As we move towards 1st June, the multi-ministry task force is making preparations to ease some of the circuit breaker restrictions. I want to emphasize again that we have to be very cautious in reopening. Therefore, we will need to take a step-by-step approach to reduce the risk of a second wave of infection. We have also put in place additional safeguards to ensure a safe reopening. For example, from this week, we have made the deployment of safe entry mandatory in places where individuals are likely to be in close proximity to one another for prolonged periods or in enclosed spaces. In recent weeks, most of the community cases appear to be related to work or households. For households, transmission is very difficult to prevent because of the close and intense interactions among household members. Our priority is first to protect our seniors in the households. Our strategy to do that is to encourage our people to stay at home for as long as possible and as much as possible. Not just among the old, but also the young. This is to prevent bringing back virus home. At the same time, if a person is infected by staying at home, will also prevent the virus from leaving home and infecting others in the community. To prevent work-related cases, employers will be required to implement safe management measures in the various workspace settings when they resume operations. Telecommuting will remain the default. This may not be possible for some settings. Telecommuting may not be possible for some settings such as manufacturing, but even for manufacturing, the administrative and office-related functions should still be home-based where possible. The principle really is to reduce the need to leave home as much as possible. Other than working safe, we are also preparing the workers in the dormitories to go back to work by testing and screening them in the coming months. These dormitories will then implement safe living protocols to reduce the risk of infection as they prepare to resume work. Minister Josephine Teo will share more details on safe living and safe working at the dormitories shortly. We have made significant adjustments in the way we live and work, and they have yielded results. Many of these should not change after 1st June. The good habits of safe distancing, personal hygiene, and wearing of masks when we are going out must continue. So let us all play our part to keep everyone safe. Now, I'd like to invite my Director of Medical Services, Professor Kenneth Mak, to give an update on the medical side.
Thank you very much, Minister. The press statement this afternoon had announced that the Ministry of Health had preliminarily confirmed an additional 793 cases of COVID-19 infection in Singapore. The vast majority remain work permit holders living in the foreign worker dormitories. There's one Singaporean permanent resident case reported today. This brings our total to 26,891 cases overall. The community cases remain low, and we will start to see more cases also being progressively discharged over the next few days. Thank you very much.
Good evening, and thank you all for being here. I think earlier my colleagues had given you a presentation, a technical briefing on what we are going to do with regards to safe working and safe living. What I hope to do is to take a step back and to give the broader context and the reasons why we have embarked on the measures that were just shared with you earlier in the evening. The COVID-19 outbreak is very challenging for, all societies worldwide, and it is fundamentally a public health challenge. And our understanding of the behavior of the virus has also evolved. For example, it is now much clearer that the symptoms can be very mild, and there may be even transmissions where the symptoms are not at all obvious. We also know that the risk of transmission is present in all aspects of daily living, between co-workers at workplaces, and we are talking about offices, as well as even construction work sites. It can transmit between friends at social gatherings, social settings, from karaoke to shopping. And it can certainly transmit within households, within families. And in particular, where many people live together, regardless of the room arrangements or the hygiene standards, the transmission risk is higher. This is quite evident when you consider the clusters that were identified on luxury cruise ships and even an aircraft carrier. The rooming arrangements on these vessels are 2, at most 3 to a room, and one can certainly consider the hygiene standards to be very high. But because many people live together, so as a result, the transmission risk becomes higher. Now, in the case of Singapore, from January, we had stepped up measures in the dormitories where our migrant workers live. The moment that the evidence emerged that the virus had spread in these dormitories, we decided that we have to take a comprehensive approach towards dealing with it, and so we mobilized an interagency task force so that the whole of government resources can be brought to bear to deal with this challenge. And you will recall that we had explained the strategy. Where there were clusters in the dormitories, we wanted to contain the spread. And then where there were no clusters yet, we wanted to prevent those clusters from forming. And at the same time, we moved out a group of workers that were still needed for essential services, essential work, and we tested these workers. So that took place. And in implementing these strategies, we first focus on things like the basics. We have to get the food, the hygiene, making sure that people had their basic things like salaries attended to, were able to communicate with each other. And then in the second phase, we spent a lot of effort to strengthen the medical support for the workers who continued to live in the dormitories. So those things were done. And with the progress that we have made, we are now getting ready for the third phase, which is focused on helping not just the workers to recover, but also getting them ready to support their employers when the conditions allow for their work, for their businesses to restart. So that is the recovery phase that we are at. Now, the important question, of course, is that our plans for the recovery, what is really needed? And it must be anchored on our understanding of how the virus transmits it and also the transmission risk. What we do must be anchored on our understanding of the risk. And the risk really is that the virus spreads not only where people live, but also where they work and where they socialize. And so measures at the dormitories are needed, definitely, for safe living. We know that to be absolutely critical. But we also know we must go beyond that. And therefore, efforts to ensure safe working must also be put in place. And as was explained earlier during the technical briefing, besides safe living, besides safe working, there is also another work stream that we will share more later about, how during off days, rest days, we might have to make adjustments to the way people go out, for rest and relaxation. But that will come later. Now, for safe living, one key plank is really to monitor the health of these workers. I've explained earlier that many times the workers themselves did not know that they were unwell, even after testing positive, because the symptoms were so mild. And to do that, we are leveraging on technology. We explained on Sunday that we were setting up tele-kiosks, using telemedicine for teleconsultation, and also giving them devices like oximeters over and above the thermometers that they can use to measure their temperatures. And so as a result, they can also test, or rather assess their own heart rate or level of oxygen in their blood. So that's what we are doing in terms of health monitoring. Now, earlier this week, we had explained the plan for systematic testing of all the workers residing in the dormitories. And in future, we will also have regular testing of all these workers so that we can detect the infections early. Now, the health monitoring and the testing regime will have to go hand in hand with more stringent, safe distancing measures within the dormitories. So you had the briefing on that already. Now, these dormitories were designed for communal living, where the workers socialize and interact closely on a day-to-day basis. And going forward, we will have to see how best to make adjustments. But in the existing dormitories, we will have to, right now, implement new measures such as setting up facilities to segregate the workers, and also do things like prevent overcrowding at the communal facilities. So designated kitchens, communal kitchens, designated times that you can use it, designated toilets, designated wash basins, and also to stagger the times that people use it to prevent the overcrowding. And we will start these measures in the blocks for recovered workers. And this morning I visited one such facility, and so this work is ongoing already. That takes care of the safe living. For safe working, the government is also working with businesses to implement safe management measures at all workplaces. But keeping in mind that a large number of the residents in the dormitories, they work in construction, a special focus on safe work sites. That is something that we have worked with BCA to implement, and have also shared with the trade association and chambers and gotten their support for this aspect of the work. So I won't elaborate too much on this. But suffice to say that safe living together with safe working are some of the most important things that we need to do to try and prevent the risk of recurrent transmission. We cannot eliminate the risk completely, but we can try to reduce it as much as possible. So those are the things that we are doing, and we want to thank very much the dormitory operators for working with us. It's a huge effort at the dormitories to try and create these blocks for recovered workers. There is a lot of effort involved in trying to implement these segregation measures, but I'm very cheered by the fact that the dormitory operators tell me that the workers themselves support these measures. And even though it requires a lot of change in their, habits, it involves change in what they have been accustomed to, they accept that this is for their own protection and that it will enable them to resume work when the conditions allow. So I want to thank the dormitory operators. I also want to thank the workers very much for accommodating these changes, as well as their employers, because the number of things that they have to get used to in these new arrangements is quite considerable. So it's not a small effort at all. Thank you.
Good evening. We are continuing to make progress in our fight against COVID-19. We are stabilizing the situation in the dormitories, and our community numbers have been continuing to decline. Recently, you also see that we have more discharges than we have new cases. So the number of active cases in Singapore is also declining. And that puts us in a good position, as we have said, to start preparing for our next phase, which is to ease some of the circuit breaker measures and enable our workers to start resuming work, including the migrant workers in the dormitories who have either recovered or have been cleared and tested and cleared from the virus. So the Ministry of Manpower has laid out very clear guidelines on how this can happen for the overall workforce. But let me focus on the construction sector in particular, because this is a sector where there are indeed higher transmission risk due to the nature of the activity and the mixing of workers across different dormitories and in the work sites. We have been discussing with the industry, with industry association, with contractors, and they too understand the need to put in place changes and new measures to ensure that construction work can resume safely in this new COVID-19 environment. So we are going to introduce new measures that covers the end-to-end precautions from accommodations to the transportation of workers and down to the work sites. The one key change, for example, is that we will require for any project, the workers involved in that project, and usually they will come from multiple contractors living in separate multiple dormitories. But as part of the new requirement, we will now require them to be housed together. If you are working on one project, then you are housed together, and you can be housed in a block within a dormitory, an existing dormitory, or you could be housed on-site in a temporary quarters which the contractor may wish to set up. Now, that's one illustration of a change that we are putting in place so that even if a transmission were to happen in the work site, it will not go back and infect multiple dormitories, right? It will be contained. We are also going to ensure that there is minimal mixing of workers, communal activities, as Minister Teo had already highlighted, in the dormitories or in their living quarters. Within the work sites itself, there will be new safe distancing measures and precautions, including having workers segregated into different teams, working in different zones, and not being cross-deployed. We will use technology like Trace Together and Safe Entry to ensure that the precautions are put in place. And we will importantly also have routine, regular testing of workers on a periodic basis, perhaps over a 2-week interval. So these are quite major changes for the entire construction industry in Singapore. The contractors understand this, and they are preparing for these changes. And because they are such massive changes, what we will do as we resume work is we will select a few projects involving perhaps about 5% of the construction workforce that are ready to work in early June, and then start working with the contractors and the workers involved in these projects to put all the measures in place. So we will resume construction work in a very careful and controlled manner. When we are ready, and when, importantly, the other contractors are ready, we will start scaling up progressively. So it's important to realize, just as for the easing of the circuit breaker restrictions, we are not relaxing everything on the first day on 2nd of June. We are doing it in a careful and calibrated manner. Similarly, for construction sector, work will resume in a controlled manner. It's better to get it right than to rush into it and then see a recurrence of large clusters in this sector. So I hope the industry understands this. There will not be a 100% resumption of construction activities from day one. It will be controlled. But the industry can make use of the time now to get ready, put in place all the safeguards and precautions so that as and when the workers recover and are ready to get to work, the industry itself will be ready and in a good position to get started. I think members of the public will also have to be mentally prepared that because we are doing this in a controlled manner, that there may well be some delays in existing construction projects because not everything can resume immediately. Right? So there may well be some delays in existing construction projects, but we will try our very best to manage this in a way that minimizes the delays, but also ensures that we only allow construction work to start in a safe manner. Right, so this will be the work that's happening now in the built environment sector. The agencies are actively engaged with all the firms involved, and we will work with them to ensure that we can get work started and resumed over the coming weeks and months. Thank you.
Thank you. We'll now open the floor for questions.
Thank you, panelists. For the first question, could we invite Yan Liang from the Straits Times? Yan Liang, please ask your question.
Hi, Ministers. You mentioned that there is already a short list of construction projects on a priority list to restart first. But in the case of, say, BTOs and residential works, will contractors that are beyond this list get help to put in place the 3 criteria? And then on the same topic, will priority go to public works? And if so, is there an appeals process for private developers? Thank you.
Thank you. We have a list of projects that we have identified. These are mainly critical and time-sensitive ones. And certainly we will be prepared to consider other projects. But it's not on the basis of the merit of the project. It's on the basis of whether the contractor is ready and has all the safeguards and measures in place. So even if a project is most meritorious of resuming work, but if the contractor is unable to show that all of these safeguards are doable and they are unable to get their workers put in place together in the same site, they are unable to get the measures in place at the work site, then they will not be able to resume work, no matter how important that project is. So the first priority is that we want construction work to resume safely. As I said, we are starting with a list of projects which we think are more critical and time-sensitive. It's really to use these projects as a way to also work with the contractor and iron out all the teething issues on the ground that need to be done. At the same time, we are also beefing up our inspection teams on the ground so that we will be able to inspect and audit all the measures that the contractors are putting in place. So I think it's better that we start in a controlled manner, make sure the safeguards are in place. But if a contractor were to come along and say, we have the workers, we have the safeguards, we have all the measures in place and we are good to go, then we will certainly consider these projects outside of the approved list.
Thank you, Minister. For the next question, could we please have Tessa from Today? Tessa, please ask your question.
Hi, so my question is about the community cases. Today it was announced that only 1 Singaporean and permanent resident has the virus. So I was wondering whether this means that we've successfully flattened the curve for the cases in the community.
It's a very challenging question because we have to bear in mind that today the community cases are low, primarily because of the circuit breaker measures that we have put in place, including that we have actually moved a lot of the working environment to home-based telecommuting, and we have actually stopped the bulk of the construction work in Singapore. So as we restart the economy, as we allow more people to return to work, as we allow more activities to resume, we have to be very careful, because if we are not careful, the number of cases will spike up and you may have big clusters forming again. So therefore, as I mentioned earlier, we need to do it in a step-by-step approach, take a cautious approach, make sure that we do it safely so that we are able to continue this journey of reopening. We do expect that as we open up more, as some of the circuit breaker measures are rolled back, are relaxed, we will likely to see the number of cases in the community going up. We hope that if we do it carefully and do it right, the number, even as it go up, it will continue to go up slowly and it will continue to remain under control. And we will be able to step up our contact tracing, our quarantine efforts to minimize the risk of transmission in the community and minimize the risk of large clusters being formed. So I think the strategy is to do it carefully and slowly so that we expect a higher number of cases in the community as we go forward, as we open, but we hope to prevent a big cluster or a sharp spike in the number of cases, which will then require us to perhaps reintroduce some of these circuit measures to continue to suppress the number of cases. Maybe DMS would like to add on.
Yes, that's right. We are watching very closely as we ease off some of the restrictions we put in place. What will be key is to look at the number of cases we have in the community, how many of them remain linked to existing clusters and how many of them are not. But it's all contingent really on us continuing to do our bit to not go out unnecessarily, not to mix and have too much close contact. Even as we start or to carry out some of these activities again, the social interactions have to change, and we must be mindful that these are the at-risk activities that in fact potentially lead to clusters forming. The team is very vigilant about tracking this, and we are committed still to making sure that as we pick up cases, that we will continue to isolate them, do contact tracing if only to make sure that we don't have a big cluster then that forms in the community, as Minister has said. We will watch this very closely as we ease off on these restrictions.
Thank you, panelists. For the next question, could we please have Hui Min from CNA Digital? Hui Min, please ask your question.
Hi, yeah, thanks. Can you hear me?
Yes.
Yes, go ahead.
Okay, so many people will be anxious about the progress of their BTO flats. Just wanted to ask if these projects will be prioritized when the construction industry restarts.
We certainly understand that there will be people anxious about the status of their projects. It could be public housing, it could be private condominiums, it could be a whole range of projects. So there will be some prioritization. We will certainly take into account these considerations when we prioritize the projects, their criticality, the time sensitivity, whether or not, for example, there are safety considerations in that the work has to start sooner. So there will be a whole range of considerations when we start looking at which ones to prioritize. But as I said, the one important criteria is the readiness of the construction of that particular contractor and all the subcontractors associated with that project, whether they are ready with and able to implement all the safe management practices we require of them for their workers' housing, for their workers' transportation, and for the work sites itself. That's critical. So a lot of it hinges on that. And if the contractor, despite our prioritization, for example, if the contractor comes along and says, look, you have not prioritized me to be at the start of the list, but I am ready because I have a temporary dorm on the work site that can house these many workers. I am ready with all the precautions that you have required in your checklist. I tick all the boxes and I can show you. Then we will certainly be prepared for that particular contractor to start work as well.
Perhaps let me add to say that to explain why safe working is very critical. Because if we allow the projects to start without putting in place adequate precautions, you are going to see cases emerging from the work site and maybe even clusters forming. And when that happens, we would have no choice but to shut down the work site. So it is better for us to be careful, to start gradually, to start from a cautious approach, to make sure that we are able to introduce safe working environment for workers as well as work sites.
Thank you, ministers. For the next question, could we have Rinso from Zhao Bao? Rinso, please ask your question.
I'd just like to check on the SHN that will be lifted for the construction workers because effectively 90% of them still don't get to go to the workplace. So does that mean that they are still restricted in their movements of sorts? What are we looking at in terms of how freely they are able to move? Thank you.
So when the stay-home notice is lifted, what it means is that the movement of the affected workers will be the same as for the rest of us. The circuit breaker measures continue to apply to them as well. And so the advisory to them is really leave your place of residence only if you absolutely need to. For example, to pick up essentials, buy groceries, buy food, and also try to just do it one at a time. Don't go out in groups and keep that outing short. Get what you need, return back to your place of residence. So the same set of circuit breaker measures that apply to everyone else during this period will continue to apply to these workers after the period of stay-home notice. So that's what will happen to them. I think we completely understand that because their stay-home notice has been for a duration of 28 days, there may be quite, strong desire. For example, we know that some of the workers would like to remit money home, and they have not been able to do so earlier. And so the advice to them is that if you absolutely must carry out these activities, you cannot do it digitally, then try to keep this outing short and take precautions. Be sure that you wear a mask, and also the same set of advice applies to all of us should apply to the workers. Hand hygiene and so on. All of these ought to be, observed carefully. We are going to reach out through their employers also to remind the workers to make sure that they know that the circuit breakers measures still apply, and that they help themselves and also protect themselves from any risk of transmission.
Thank you, Minister. Next, could we have Philip from Bloomberg, please? Philip, please ask your question.
Thank you. Thank you, panelists. I hope you're all staying safe and healthy. I guess there's been talks with China, reportedly with some ASEAN countries, or rather with the whole of ASEAN, as well as Australia, Canada, Korea, New Zealand, regarding lifting restrictions on travel. So I would just like to ask, among these countries, which talks do you see being perhaps resulting in the resumption of flights at the soonest? Which would be the first? When might that materialize? And would you rule out June for any lifting of those travel restrictions? Thank you.
The discussions are underway. I think it's too early to say which country will be first or whether this can happen in June. But we have, I think, made quite clear what our considerations are when we look at some easing of the travel restrictions. We do want to ensure that this is done in a safe and controlled manner. And I think all the countries that we are discussing with feel exactly the same way. So whether it's a combination of pre-departure testing, arrival testing, tracking of the traveler when they are in the particular country, these are all possible measures that can be put in place. And the discussions are currently underway with various countries.
Thank you, Minister. Next, could we have Aradhana from Reuters? Aradhana, please ask your question.
Hi, thank you. I just had one question, which was that basically now that you're doing mass testing in the dorms, I was wondering if you would be studying the number of, say, asymptomatic cases in the dorms and presenting those results.
Whether we are...
Can you repeat your question, please?
Can you hear me?
Yes, we can.
Hello?
Can you just repeat the question, please?
I was just wondering, now that you're doing the mass testing in the dorms, I wondered if this is something that you will be studying, the number of, say, the cases of asymptomatic cases in the dormitories and presenting
studying the
those
number
results.
of asymptomatic cases. I got it.
ask DMS to explain?
The interagency task force is in fact engaged in many different testing exercises that are going on at this time, and they're doing it across different dormitories. They're doing it for a variety of different reasons. One, of course, is to assess what the prevalence rate might be in some of the dormitories, to assess the success and effectiveness of their strategies at this time, to isolate foreign workers who might be suspected of having COVID-19 infection, and separating them away from others who are either without symptoms or not infected at all. They've also started to look at the possibility of testing in a very controlled setting various foreign workers in some of the dormitories with a view towards categorizing them better. And then hopefully that may allow us to see through various strategies of returning workers back into the community and back into a productive routine as well at work. But many of these are still in progress, and we're not at a stage where we'll be able to give you a summary of these results, but we'll continue to work with the interagency task force, and when they are ready, perhaps with more mature results, we might have something then to share with all of you.
I think just to add on, the primary objective of this mass screening of our dormitory workers in the dormitory is to prepare them to return to the economy, to return to work. So the idea is to screen them to see whether they are able to go back to work. But at the same time, when we finish the screening, the results of the screening will be very useful for us to do research and study on the pattern of infection, and this will come later. So the priority and the focus now is to screen the workers to prepare them to return to work.
Thank you, Minister and DMS. Next, could we please have Kek Ling from Shinmin? Kek Ling, please ask your question.
Hi, so my question will be on, other than, BTOs and all this, how about shop and houses that need to renovate, because they bought a new house? Is this something that will be opening up soon?
So we are mindful that construction involves more than just major construction projects, work sites. There are also construction workers involved in renovation. We will allow, we will consider particularly the projects where renovation had been ongoing and then was suspended during the circuit breaker as a priority, right? Because these have been suspended for quite some time. So as part of the package of possible easing of circuit breaker measures from after 1st June, this is certainly something that we are looking at. But beyond that, beyond these kinds of projects where they were caught because of the circuit breaker, when it comes to new renovations, I think then that's something different. We'll have to take that into consideration. We will have to consider that separately from the ones that were caught because of the circuit breaker. And then the considerations there will be, again, whether or not the contractor, the renovation contractor, has the workers ready, whether the workers are tested, and then whether they can ensure the safe management practices at work. Of course, the scale of work is completely different, right? These are, you're just going to someone's home to do renovation, very different from doing at the work site. The number of workers involved is also very different. So if, as I described, if renovation contractors subsequently come forward and assure us that they can do this safely, that they have the workers, housing of workers are taken care of, the work arrangements are taken care of, the transportation of workers are done safely, then certainly, under the framework that I had described earlier, they will be able to start work on renovation. But it's subject to all of these conditions.
Thank you, Minister. Next, could we have Kai from Channel 8? Kai, please ask your question.
Okay, thank you. Hi, regarding of the safe living measures for dormitory workers, will the operator be required to reduce the number of beds in the sleeping room to make sure there are enough spaces to reduce close contact and transmission in the sleeping room? Is there a guidelines on the numbers? Thank you.
I think The aim certainly is to try and reduce the numbers, whether it is at the room level, unit level, floor level, or even at the dorm level. That is the aim, and we will progressively try to do that. However, we have to be mindful that this does put quite a lot of pressure on the arrangements at the dormitories, so it will take time. And it largely depends on how soon we can identify appropriate places to build up capacity to house the workers who would otherwise have returned to the dormitories. So that is something we are working on, but that is the aim, and we will progressively get there.
Thank you, Minister. Next, could we have Nicholas from Yahoo? Nicholas, please ask your question.
It was mentioned in the technical briefing that going forward, the goal will be to test workers every 2 weeks. How many workers do you estimate will be tested at this interval? And can we clarify if the government will be bearing the cost or will be sharing the cost with the employers?
For construction workers, so the intent is that so long as the construction workers are working on site, then we would want to put in place a regular testing regime at the interval of perhaps 2 weeks. So that the number of workers who are being tested will depend, as I said, on the number of workers who are resuming work, but progressively it will scale up, and we want to test all the workers who are working, who will be resuming work, and it will be done on a regular basis. This will be a new regulatory requirement on top of all the other safe distancing measures that we have put in place, that we are talking about, that contractors will now have to uphold. So I have no doubt, and as with all regulatory requirements, the principle must be that the company must bear the cost. So I have no doubt that it will mean construction costs in Singapore will be higher because of these regulatory requirements. Right? And all of us have to be prepared to pay this higher cost because we want construction work to be done safely in Singapore from henceforth.
Thank you, Minister. Next, could we have Felice from the Wall Street Journal? Felice, please ask your question.
Hi, thank you. Mr. Lim mentioned during the technical briefing that workers who are returning to workplaces at construction sites will be required to use the Trace Together app. I'm wondering if you have ruled out making apps like this or other tech-assisted tracking methods mandatory for the broader population as you're considering easing restrictions.
Yes, thank you for the question. This has been asked before, and I can understand there's a lot of interest in this. We are studying how the apps can be. We have a Trace Together app which we have already launched. It's based on Bluetooth. It allows us to identify contacts quickly through Bluetooth on your phone. We are in the process of looking at how the app can be more effective, working with Apple and Google, because the existing app on iOS phones, there are some technical issues. So we have been working with both Apple and Google to see how the protocols can be enhanced so that the app can be more effective. Separately, I've also explained that we are looking at solutions for those who may not be smartphone users. So that could entail the form of wearable dongles that people bring along with them so that we can, again, through such a solution, quickly identify the contacts. So while we go through these different technical solutions and we are continuing to explore, I don't think we want to rush to make anything mandatory at this stage. We want to identify what's the best possible solution and then eventually scale that solution through the rest of the population. Thank
you, Minister. We now have time for two final questions. First, could we have Sihui from Channel News Asia? Sihui, please ask your question.
Hello. I just need to find out for work sites that are not resuming their construction or their work, who will be paying their salaries?
So there are already a set of measures that the government has provided for employers, even today, where work has not started, where construction work is completely frozen. There are a set of measures that the government has provided to contractors, including waiver of foreign worker levies, as well as rebates on the levies, so that the employers will be able to pay their workers even during this period. We will continue to see, as I said earlier, how fast construction work can resume. I can't tell now because we have just put out these requirements, and then we will be engaging the industry to see how ready they are in getting prepared and being able to comply fully with all of these new requirements. So again, if there are contractors that will have to take more time and their projects may be delayed for quite a while, then we will have to see from the part of the government if additional support may well be necessary for these contractors. Right? But at this stage, I think our focus now is to engage the industry, because at this stage today, we are still at the circuit breaker. There is no construction work. The relief measures are already in place. So let's now engage the industry first, get them to use this time now to get ready for all the safeguards that are needed and make sure that they are ready to go once the workers have recovered and are able to resume work. So that's our focus at this present time.
Thank you, Minister. For our final question this evening, could we please have Li Wen from Asahi Shimbun? Li Wen, please ask your question.
Yes, hi. I would like to ask on the question on accuracy of the test. We've seen earlier that there's a false positive, and then what if there's the false negative? Then how is this going to affect those workers returning to work? Thank you.
Thank you very much for the question. Yes, tests can have both false positive and false negative rates. The reasons for each might vary. False negative rates may occur simply because there's problems with swab testing, and if you don't take a proper swab test, collect an adequate specimen, you may not have enough in order to be able to detect the presence of the virus and make a diagnosis of an infection. There also would be sometimes lab errors that may contribute towards a false positive or false negative rate. And finally, of course, the accuracy of the test may vary, the quality of the test may vary, and that lends itself also to false positive and false negative rates. We try to work at limiting and reducing these false error rates in the following way. First of all, we make sure that those who are doing the swab testing are properly trained and they undergo competency testing before they in fact allowed to perform their testing task. For those who are trained, they may even require a period of supervision before they're allowed to carry out their testing unsupervised. And these are ways of trying to make sure that at least at the time of collecting a specimen, this is done properly. Then we have a quality assurance program we put in place in order to try and minimize the possibility of false errors occurring through standardizing the processes within the labs and making sure that that quality assurance program within each lab is properly set up and they're monitoring how well they're carrying out these tests. It's in this context that we reported previously the series of cases which we had picked up with false positive rates as a result of a quality assurance program. And we continue to work with that particular lab to make sure that they are able to optimize their processes and prevent this from occurring again. Of course, we are also looking at the tests to determine whether these tests are the reason why false error rates may take place. Before any test is introduced in Singapore, we require these tests to be validated locally. We do know that they come with testing already done by the manufacturer, and these would have been made available when they were registered in Singapore. But we want to make sure that there's also local validation done, and that validation allows us to determine in a real-time setting what the results are likely to be, and then allow us to determine whether these tests are useful for the purposes of supporting the work we're doing in controlling the outbreak across different settings, whether in the community or in the dormitories as well. So a number of tests have been validated by us for use, but yet also other tests have been assessed, and we've chosen not to use some of these tests simply because they have not met our standards. And we continue to look at this. You are correct that false error rates can be significant because they may lead to a person being wrongly diagnosed to have infection, or a person assumed not to have an infection but was in fact infectious. And therefore we aim to keep these rates as low as is possible. There are no tests available for any disease where the test is 100% sensitive or 100% specific. In other words, in every test, there often will be a situation where there may be false errors that take place. And this is intrinsic due to the fact that these tests may not be accurate completely. And therefore, the process we put in place are aimed to try and reduce these error rates to mitigate the risk of harm to other people as a result of these errors.
Thank you. I should also add that testing is very important. It's a key strategy for us to be able to open up our economy and to return to resume some of our social activities. But testing is not the only strategy. Testing has to be seen in the context of the whole basket of measures that we're putting in place, whether it's safe working, safe living, and safe distancing. All these will work together to ensure that to help us to have a safer environment, and therefore ultimately all of us must remain vigilant. And I know 1st June is approaching very quickly, and there's a great expectation from among Singaporeans what will happen after 1st June. First, I have to say that we are not going to have a big party after 1st June. It is still a very tight situation where we need to continue to impose many of the circuit breaker measures to ensure that our number of cases do not spike up. And we appeal to Singaporeans to bear with us. We have worked very hard. Many Singaporeans have worked very hard over the last few weeks and have maintained a very tight circuit breaker measures. And we hope we continue to do so to help to keep the number of cases low so that we can progressively open up more and more as time goes by. So we urge Singaporeans to continue to cooperate with us and to support our measures going forward so that we can have a gradual and safe return to activities. So thank you very much for being here with us.